Hello and welcome. I'm Dr. Pat McShane, and today I'd like to talk to you about a study about avoiding frailty. When I say that word, I'm sure you have a picture in your mind, perhaps of an older woman, and it turns out that frailty is more common in women, going down the hallway of a nursing home in her walker or maybe in her wheelchair. You probably have someone in your life, friend, family member, who's frail themselves or who seems to be going in that direction. So you have an idea of what I'm talking about, I suspect. Some of us may be noticing signs of frailty in ourselves, a reduced energy level, not as easily able to get up out of a chair or walk up that flight of stairs as we used to be. So we have an idea of what it is, and this is something, it turns out, that's clinically very, very relevant because frailty is a precursor to increasing frailty typically, and ultimately death and a lot of severe disability before that. So this is something that we can try to avoid. Aging is not synonymous with frailty, and that is a misconception that we need to disavow ourselves of right away. There are people in their 60s who are frail, and even 40s and 50s for that matter. Many, many more frail people in their 70s and 80s, but there are people in their 90s and even over 100 centenarians who are not frail. And that is the goal, of course, of the idea of Healthspan. So put the idea out of your brain that aging and frailty are synonymous, because they are not. Studies in the US have shown that about fewer than 10% of people in the 65 to 75 category are frail, but more than 25%, again in the US, in folks over 85. Women more than men, Blacks more than whites. The data isn't quite as good for Asians and Hispanics. And what are the causes of frailty? Well, some of them are socioeconomic, living in poverty, living alone, not having good access to things that one needs to sustain one's well-being, psychological factors, depression being a main one, nourishment, nutrition issues. If one doesn't have access to good food, or that's not a priority in one's life, too many medications or a lot of medications can make people have lower energy level and poorer balance and so on. So that's something to keep track of. Certain diseases are much, much more likely to render one frail, such as Parkinson's or multiple sclerosis is another good example. And then poor physical activity. So these are kind of the big ones that we know can cause frailty. And again, as I mentioned, folks who are frail are more likely to have falls. They're more likely to have hospitalizations. They're more likely to have dependency and need to be in some kind of a structured living situation. They're more likely to have disabilities, more likely to have difficulty recovering from illness, and more likely to die. So the clinical scale of frailty has been used to assess various outcomes, and that's what was found. So the study that I mentioned at the beginning was performed in Ireland, and they looked at other studies before their study, which different components that had been used, some of them successfully and some of them not, to try to avoid frailty. And the two that they landed on were physical activity and protein intake. And we haven't talked much in this series about protein intake. We talk about physical activity almost every video that I have made, because it's so critical to our healthy functioning as we get older. The study subjects were patients in primary care practices in Ireland with a mean age of 77. more than half were women. They were rated pre-frail or robust or mildly frail at the beginning of the study. The two interventions that were used included physical activity, which was a training that the subjects underwent in the doctor's office, and instructions about eating 1.2 grams per kilogram of protein each day. The protein recommendation for women in this study would have been about 60 to 80 grams per day of protein, which may seem like a lot and is more than most of us are taking. I have actually seen even larger amounts recommended, 100 grams per day or even 150 if someone's trying to build muscle. So this recommendation is in line with others that I have encountered. We're going to talk more about dietary requirements over upcoming videos. These subjects were followed up over 3 months about their compliance with the protein intake and the exercise. And the exercise that was recommended was both aerobic kinds of things like walking and resistance of the major muscle groups, strength training. At the end of the study, the folks who had been randomized, it was a randomized trial, to the activity and protein side of things had about 1/4 risk of frailty as the people who hadn't been randomized to that active group. And that's an enormous reduction. And the patient acceptability was huge. About more than 2/3 of the people said, oh, it wasn't very hard. And actually, I feel better than I did before I started in on this study, which is, of course, music to the ears of the investigators, because these are things that we would hope would be generalizable to the population. So the message to me in this study is that, yes, frailty exists and it's not going away, but there are things we can do about it. The two that were shown in this study, and they were, of course, both part of the study, but in earlier studies, they were studied individually, were the physical activity, particularly resistance exercise, and protein intake. So let's talk for a minute about physical activity. We know that as we get older, we tend to lose muscle mass, and that's a major risk for our general well-being, for our balance, for our energy and ability to do any minor kinds of things like even shopping or just going outside for a short walk. So loss of muscle mass is has many different factors included in it, but the main two are physical activity and protein intake. So you got to use it or lose it, as we've all heard that saying. The other half of the muscle mass story is protein. And it turns out that as we get older, we have what is called anabolic resistance. And anabolic means gaining muscle. And the likelihood that we're going to, with the same dietary amount of protein, be able to use that protein to build muscles or even maintain muscles diminishes as we get older. And all the mechanisms aren't clearly worked out about that, but it's been shown over and over in both animal and human models that we just don't get the same absorption and intake into our muscles of our protein as younger folks do. So 1.2 grams per kilogram may seem like a lot, 60 to 80 grams per day, as they did in this study. But I've heard recommendations even higher than that for older people, which includes myself. So that is what is recommended, and to overcome the resistance that our bodies have. If you are vegan, it can be very difficult to meet these protein requirements. And if you are in any way supplementing, you might be looking out especially for the branched chain amino acids, which is valine, isoleucine, and leucine to build the muscle. Those are the most relevant and efficient amino acids that you can be taking. So I hope this information is useful. I found it yet another great reminder of what we need to be doing. And my take home message for today is take a look at how much protein you're eating. You might not be paying a whole lot of attention to the amounts or the labels. I actually recently just bought a kitchen scale because I'm not that good at knowing what 3 or 4 ounces of something is. So I did that just to check up on myself and make sure that I was taking enough protein. So that's my recommendation. Take a look at what your physical activity level is. If you're hitting the recommendations of 75 minutes a week of vigorous activity or 120 minutes of mild to moderate, including walking and so on. So if this information is useful, please like and comment and subscribe. And if you have something you'd like me to cover in the future, please put it in the comments. Great to have you on board. Hope to see you again soon. Take care.